This is good, very good question. So for the lower jaw, any jaw, I recommend having two wires. So for a full arch case, you use the bottom wire as 1.8 mm wire, and on top of it another wire as 1 mm, keeping the wires as close to each other. 1.8 and second wire is 1 mm. So effective आपका जो splinting effect है वो 2.8 mm आएगा. बराबर है. If it is a segment case जहां पे आपने दो तीन इम्प्लांट बाजू बाजू में लगाए, you can have one single wire of 2 millimeter. It's a thicker wire, difficult to manipulate. 1 mm wires are only used as supporting wires. They are never used as sole wires. मतलब खाली 1 mm के वायर से आप काम नहीं कर सकते. जहां पे भी एडिशनल रीइंफोर्समेंट चाहिए, सपोज 2 किया, उसके बाद भी मेरे को लग रहा है कि और होना चाहिए, तो मैं और 1 mm भी डाल दूंगा. तो प्राइमरी अपना काम 1.8 and 2 mm. Regarding wires, 1.8 है 1.6 है 1.6. I'm sorry. So 1. Sometimes what I do is 1.6. So it makes it 3 mm. मतलब मैं 1 नहीं लगाता, उसके बदले और एक 1.6 लगाने का.
So 2 1 is 1.
2 1s, they are too flexible, madam. When it is too thin, no, it is too flexible, and when the patient bites, it may break in the mouth.